You mentioned that we have a system or not a system. Could be viewed either way. But a lot of Americans are concerned that in the chase for profits, Americans are being hurt. And this clip we're going to look at now is one man's story of what happened to him with his insurer when he was being treated for leukemia.
I joined a group that is supposed to help you get hospitalization if you are a small company. Apparently it was benzene exposure from a company that I used to work for, which causes the type of leukemia that I had. I mean, I'd had this insurance for 12 years, always paid the premiums, they always took care of everything. And when I reached a certain level of payout, apparently they decided, hey, we've spent enough on this guy, let's look for a way to out him. When they contacted me, they asked me if I was working. And I said, well, no, I'm recovering from leukemia. They said, well, if you're not working, you no longer meet the criteria to be a member of this group, so we're going to have to cancel your hospitalization. My chances of living through this from the first bout were about 30%. Apparently they have a limit to what they'll spend. They have no limit as to what they'll take from me, but they have a limit as to what they'll spend on you. You had to be working in order to be a member, or in order to join. They never said, if you get a serious illness down the road and you're unable to work, we'll cancel you. They have ways of pulling it out from under you. And if they do, you'll be in the same boat that I am, stuck with a possible returning illness and no way to get health coverage to take care of it.
So what happens if you get leukemia again?
I've got major problems. I'll lose everything I have.
What is your reaction to what we've just seen?
Health insurance is problematic. Health insurance doesn't really follow the classic insurance model. It's only recently that we've gotten into the health insurance business. We do life insurance and those sorts of business, but those are one-time losses generally. They're predictable. They're large losses, not a series of small ones. They generally are not desired by the consumer of the life insurance product. So that health insurance is not a good insurance product because people want to use the services when they have it. Moral hazard is what that's called in parlance. That it's small, frequent losses, not a big catastrophic loss. It's hard to predict because patient-seeking behavior varies down the line. And so as a consequence, insurance companies had tried to modify the classic insurance model, life insurance, to health insurance. And it just does not translate well, one. And two, the nature of the health insurance model that we've got. And let me come back to something that Bill said, and that is the notion of this nation of rugged individualists, and many would call it a center-right nation, insist upon a commercial approach to health insurance. Remember that health insurance didn't exist really until Blue Cross and Blue Shield in the 30s. And then the 40s, what happened is when John L. Lewis, the UMW, could negotiate for wages, what he did is negotiated for fringe benefits. So that was the beginning of our employee-based health insurance system. It was driven by the wage and price controls during the Second World War. So we had the growth of employment-related health insurance. So the market, the character of its development, the issues surrounding it are neither consistent with an insurance model nor would have been the most rational way to approach the health insurance development in the United States, and is predicated on a commercial operation that requires that profit be returned to shareholders.
Precisely. Actually, what is the purpose of health insurance? The purpose of health insurance is to make a profit for shareholders. Now, as a byproduct, we buy it hoping that it will also save us from from high amounts of out-of-pocket expense when we are ill. But remember, 750,000 personal bankruptcies occur in the United States annually on average due to healthcare costs, due to people being unable to pay for health care. Some of those folks are insured, but end up having conditions that are not covered by insurance because they were pre-existing or something like that. It's a significant problem. We're the only industrialized society in the world, by the way, that tolerates this. In most other places, it would be seen as a scandal.
Insurers themselves, men and women of conscience, have concerns with some of the behaviors that are occurring in the insurance industry. Let's listen to these comments from Marty Hauser.
Is change needed in America? I would argue that almost every insurer that you talk to, every executive of every insurance company would say that we are not happy with the way the system currently works. And where I see healthcare policy going in the future is that there will be some kind of combination of both private insurance and government mandate or government insurance. If you think about health policy is driven by values and human issues. Health insurance is a business, and as a business it operates in a business environment, and until we reconcile the differences between health policy and business, we're going to continue to have a lot of dialogue in the United States about how to solve our problems. And the one thing that we've not talked about in the United States is if we move to a universal plan, we're still going to face the issue of having to have a budget, and where do you stop paying because you no longer have the budgeted dollars. And so as we begin this debate and the role of government, one of the things we may want to look at is something as simple as what we call the pre-existing exclusions. If we could just mandate that all insurance companies have to take all comers, regardless of their health or pre-existing conditions, we could begin to address the problems immediately, but it has to be a level playing field. All insurers have to compete at an equal basis. The insurance industry is anxious and eager to take a leadership role in engaging in that dialogue because, as I perhaps said before, we know the situation. We know what's going on. We deal with it every single day. We see the problems from both sides.
An interesting commentary, providing the perspective of the insurer. And I think that Marty's comments bring up this question for discussion. On the one hand, we have a free enterprise, for-profit insurance industry rolling, and an argument could be made that that would include others as well, not-for-profit hospital systems and for-profit hospital systems and everyone else, that look for fiscal viability and profits for shareholders in a lot of instances, or the equivalent of that in the nonprofit sector, which might be high salaries and a lot of building. On the other hand, we have individuals such as yourselves who are experts in public health policy, the needs of the people. They're colliding.
Yes, they are.
What makes more money for stockholders means somebody maybe doesn't get treatment. And this whole topic is more charged because we're not talking about gumdrops. We're not talking about a sweater. We're talking about life and death.
And large amounts of money.
And large amounts of money. Can we find a middle ground between free enterprise and public health needs?
Certainly others have. Switzerland, for example, is certainly a center-right country, maybe a far-right country in many ways. But in Switzerland, to have someone without access to insurance would be considered a scandal. Yet it's the private insurance companies there that essentially are responsible for insuring the population, but they're regulated. There are government policies that require that everyone be covered and that a fair premium be charged to everyone so that they are covered. And so a relatively small number of insurance companies in a small country actually then do provide the financial basis for access to care for the entire population. That's a model that works. There are other models in other countries that illustrate that it is clearly possible to set up an insurance model with the management of those resources being done in the private sector, and yet have reasonably cost-efficient access to health care.
I think that's a fair statement, and certainly, again, my own experience in Israel, where you had 4 HMOs, basically governmentally regulated, that are paid by the government. They get a check for a basket of service, and they compete in some measure, but everybody in Israel has health insurance. It's socialized as a part of the tax base. I think, though, it's fair, David, to think about this particular, well, 2 or 3 concepts. First of all, remember the Clinton reform. One of the lessons we came away from the Clinton reform is unless you're careful about the existing insurance that people have, you'll get a backlash. I mean, I've got very good health insurance. If you start tinkering with my health insurance, then I'm going to get very nervous because I know what the costs are associated with. I know what I have, but I have no idea what's coming. And if in fact, and in some measures, that was the situation the Clintons ran into. That if you have a lot of people who have employee-based health insurance and you begin to threaten that, people say, wait a minute, I've got my health insurance, I'm concerned about the $47 million, but don't screw up my health insurance as a part of this process to come along.
Yeah.
And I think that's how you manage that is key, and there are some models that work. But remember what I said earlier, and that is that just because you've got health insurance, you've got only access, financial access, to a broken system.